In this playlist of orthopedic rehabilitation protocol, the joint we will discuss is the hip joint. The most common pathology of the hip joint. First, we will discuss the snapping hip syndrome. It's also known as Coxa-Saltons. In this snapping hip syndrome, it is characterized by the snapping sensation or audible clicking sound around the hip when the movement occurs. According to its name, snapping hip syndrome, it has snapping sensation. It has various causes: external, internal, and the intra-articular. External is the most common. In the external cause, IT band snapping over the greater trochanter of the femur occur. In the internal cause, iliopsoas tendon is located deeply, so it's the internal cause. Iliopsoas tendon snapping over the bony prominence of the pelvis occur, and the intra-articular cause is the least common. External cause, internal, and the intra-articular. Snapping hip syndrome, we see the external cause, internal, and intra-articular. So let's discuss them in detail. In the external cause, there is gradual onset of snapping or pain the patient feel at the laterally over the greater trochanter of the femur. Described as sensation, the patient feel that hip is dislocating, may also have coxa vara. At the external, it is the gradual onset of snapping or pain sensation. In the internal cause, there is also gradual onset of painful sensation coming from deep. It is the internal, it's from the iliopsoas tendon, and it is deep within the anterior groin when moving hip from flexion into the extension or the external rotation. The iliopsoas tendon has the function of external rotation or moving the hip into flexion into extension. So in these movements, patient feel pain. And in the last cause, that is the intra-articular, there is sudden onset of snapping or clicking from an injury or traumatic event to the hip capsule. This is the sudden, or and external and internal is the gradual. In the intra-articular, it is least common and it occurs due to any traumatic event. There is a special test for the snappy hip syndrome. The first test we study is the Ober's test. It is for the external snapping hip syndrome. In this test, patient sideline and palpate the greater trochanter abduction and extend the patient hip while knee is the flex to the 90-degree. Slowly lower the leg to the adduction. This is the picture. You can see slowly the leg move to the adduction. If the hip remain abducted, this is the positive sign for the tight iliotibial band or tensor fascia lata. In the second test, we have Stange test. This is for the internal snapping hip syndrome. Patient supine with the hip flexed to the 30-degree and knee is extended. Ask the patient to flex the hip and physiotherapist resist the movement. This is the position. If the pain in the anterior groin, internal hip snapping syndrome is the positive sign. These are the two tests, Ober test and the Stange test. The third test is the Thomas test. In the Thomas test, patient supine, ask the patient to bring the knee to the chest as far as possible and hold this position. Ask the patient if he feel stretch in the groin. Tight iliopsoas if the opposite leg lifting off the table. If the iliotibial band tight, this is the if the opposite leg move to the abduction. If the opposite leg move to the abduction, it's mean iliotibial band become tight, and this is the positive sign of the Thomas test. And this is the third test for the snapping hip syndrome. This is the position you see. If the other leg move into abduction, then this test is positive. Snapping hip rehabilitation. This is our main topic that we do is the snapping hip rehabilitation. First examination finding of each patient should guide the impairment based approach to the treatment. It's depend upon the patient examination, his findings, that we go to approach the patient. Patient may benefit from the stretching of the anterior hip structures. Stretching is very important if there is tightness or the iliotibial band and its associated structures. First is the physical examination, history and complete physical examination. Then if there is any tightness in the IT band, in the any muscles and the associated structures, then the patient get benefit from the stretching. And this is the very easy question. Ober's test, we discussed it few minutes before. Tell me the answer. Ober test for which muscles? Answer it in the comment. Thank you.